my presentation was about respiratory muscle training in patients with SMA, and we followed them for 1 year, and we tried to train the inspiratory and expiratory muscles of the patients because they are weak in patients with SMA. Most of the patients have an inspiratory muscle weakness, and a lot of patients have an expiratory muscle weakness. And patients have problems coughing up their mucus and clearing their lungs, and therefore they are at risk of respiratory tract infections and eventually respiratory failure. So we thought maybe we could train the muscles. I'm a physiotherapist, I'd like to train things, so I would like to train the muscles as well. We included 30 patients, all aged 8 or older, and 15 of them went in the control group and 15 of them went in the training group. And we started the training with both groups, but the control group had a non-therapeutic resistance and the training group had a therapeutic resistance. And they had to train with a small device, either an inspiratory or an expiratory device. And if they are breathing through the device, then there is a resistance in the device, so then they have to overcome that and then they can train. And we saw that both groups increase. So also the control group who did far less than the training group. So we think that, the more you train, the more you gain. We also saw that there was a high correlation between the training volume, so how many training sessions that they do and at what intensity that the patients do, and the increase in inspiratory strength. But also the group that did less also increased. So we found that the inspiratory muscle strength is really trainable. The expiratory muscle strength is less trainable, but we are currently working on maybe we didn't do it at the right way. Maybe we have to change the training a little bit. And also our patients told us that they could cough more easily, that they talked louder, that they could sing louder also, for example, and they were very pleased with the training and they also really wanted to continue the training.